Hello again, everybody. Welcome to another module synopsis. We're going to go for Module 4. Take a look at those Module 4 objectives. Make sure you feel like you've met all of them. And if you haven't, go back through the lessons and the materials and see if there's anything there that can help you better understand. So, a little twist on my usual question. Which objective do you think was the most important to achieve, either personally or professionally? In the history of mental health, I think it's important to understand is that the evolution of mental illness was then and is now not linear or progressive, it's cyclical. When a behavior is considered normal or abnormal, it depends on the context. That's never going to change. So, whatever the context or the norms are within a society and within a culture, that's going to determine whether behavior is deviant or not deviant and what is considered normal and abnormal. So take a look at the timeline of the evolution of mental health and mental health care. What surprises you about this? Now, that's not a question that I need you to answer or anything like that, but it's something I want you to think about. Obviously, I'm not going to go through the timeline from beginning to end, but take a look at how it's evolved and how there are some real heroes in this story in terms of getting mental health care to where it is today. Is it perfect? Absolutely not. Do we still have troubles? Yes, absolutely we do. But take a look at where we were and where we are now and see that these people that are mentioned in this timeline and throughout your readings and things that you'll hear and see in regards to mental health, these people really made a difference in how mental health clients, psychiatric patients are treated now versus how they used to be treated. In your reading, you looked at the ANA Code of Ethics. Can you understand the relevancy of this Code of Ethics and what specifically seems the most relevant to you, personally, professionally, in general? Now, you can use the ANA Ethics competencies or the 9 provisions of the ANA Code of Ethics for nurses to answer that question. What about ethical principles? When we look at autonomy, beneficence, non-maleficence, justice, fidelity, veracity, role of caring. So, which one would be the most difficult to uphold personally and why? No judgment here. It's reflective questions to get you thinking about how these ethical principles are applied in real life. There are a lot of different standards of practice for nurses to follow. We have the ANA, the Nurse Practice Act, employer rules, federal regulations, Ohio Board of Nursing. The list actually could go on and on. What's important is that you understand the difference between the different standards of practice and that you are able to comprehend how you would apply those in your clinical practice with your clients and in your place of employment. Laws, torts, and malpractice. So, obviously, criminal and civil law have differences. Criminal imposes punishment for crimes. Civil emphasizes relationships between people and entities and provides compensation. So with torts, there's a difference between intentional and unintentional. This is actually really important if anything ever goes to court. Intentional torts are wrongs that the defendant knew or should have known would be caused by their actions. Examples of intentional torts include assault, battery, false imprisonment, slander, libel, breach of privacy, and breach of client confidentiality. Unintentional torts occur when the defendant's actions or inactions were unreasonably unsafe. Unintentional torts can result from acts of commission, such as doing something a reasonable nurse would not have done, or acts of omission, failing to do something a reasonable nurse would do. That's the difference between those two. Malpractice is simply a term used when we're talking about people with licenses that says they were negligent. So negligence was committed most likely to a client or patient by somebody with a license. So the implications for nurses are many. It's part of the responsibility and the accountability that comes along with having a license. So you have a duty to warn and protect. You are a mandatory reporter. You have to maintain confidentiality and the privacy of the patient at all times. You have to maintain professional accountability. Remember, we talked about responsibility is external, accountability is internal. You have to maintain competent practice. You have to make sure that you maintain professional boundaries at all times. And this is where you really need to focus on documentation, because when it comes to documentation, the old saying goes that if it isn't documented, it didn't happen. That's really important to remember, because if you didn't put it in the chart, how are you ever going to prove that it happened? So I always document like somebody else is going to be reading whatever it is I wrote. Is that the case? Probably not. There's probably plenty of times that I've written notes that nobody ever looked at, but that one time that you need it to prove or disprove something is really when you're going to wish that you had documented appropriately. This also is the category that patient abandonment falls under. Negligence, actually, is what it falls under, but that's something I get asked about a lot, and I think that it's something that doesn't happen nearly as much as it gets talked about. But it's malpractice and it's negligent, and it is when the healthcare professional improperly terminates the relationship with the patient. So, patient abandonment is grounds for nursing license discipline. In general, most nurses know this, that it's mandatory that you finish your shift, that you take care of your patients. And if for some reason, like you have a medical emergency or something like that, there are processes in place to handle that. It is time for another question. So, what worries you the most about the level of responsibility you'll have as a nurse? Remember, responsibility is external. If you'd like to talk about accountability, you can talk about that as well. But I really want to know what worries you the most about that. Patient rights are of the utmost importance across all disciplines of nursing. The Patient Self-Determination Act gives the patients the right to appropriate treatment and related services, the right to an individualized written treatment or service plan developed promptly after admission, the right to ongoing participation in a manner appropriate to the person's capabilities, and the right to be provided with a reasonable explanation in terms and language appropriate to the person's mental and physical conditions. There's a lot more, but the Patient Self-Determination Act, along with understanding informed consent, what constitutes competency, psychiatric advance directives, protective placement, what constitutes capacity or diminished capacity, and appropriate terms, definitions, and use for restraints and seclusion. All of those things are items that you need to understand both in mental health and in nursing in general. For theories, there's 5 main schools of thought: behaviorism, biological, psychodynamic, cognitive, and humanistic. From those schools of thought come theories, and from both of those come treatments. So the theories are psychoanalytic theory, theory of interpersonal relations, cognitive behavioral theories, biological theories, and there are some nursing theories. Take a good look at those, make sure you understand how all of the pieces of that sort of interact and come together to drive the care that the patient is being provided. We talked about a lot of different therapies in this module, and even though they can be categorized a bunch of different ways, and the categories in the way that they're recognized by different people, different schools of thought, might not be exactly how they're presented, which therapy type or specific did you know the least about before this module? Let me know. That wraps it up for our Module 4 synopsis. Well done, everybody, and keep moving forward.